What are you telling your patients right now when they're asking about how to stay safe out and about and avoid contracting COVID?
A lot of the same techniques that you're probably aware of that you've heard from the beginning are still the most relevant and effective strategies to use, and that is frequent hand washing, avoiding touching unnecessary surfaces and then your own face, wearing a mask when you're out in public to protect one another from the spread of the virus. Social distancing is typically a safe and easy way to make sure that you're not unnecessarily exposed. Because patients ask me very frequently whether or not they should go to a certain event or if they should even see their own family. And there's some degree of risk involved in each of these decisions, but I hate for my patients not to engage in activities that are meaningful to them or to be able to see family. So I think you have to use careful judgment about whether or not you want to go to a non-essential activity where you might be exposed to a large number of people, but while practicing these safe techniques, I think it's important people still do the things that are meaningful to them and see their loved ones and allow them to still have a productive and meaningful day.
Tulsa Mayor recently put in place a new mask mandate for all Tulsans to be wearing them in public places. What are you explaining to your patients on why that's effective and why it's being implemented now?
A lot of patients have asked me about the benefit of wearing masks, and granted, there's been some back and forth as to whether or not masks are beneficial. And I explain to people that while wearing a typical surgical mask or a homemade cloth mask even may offer relatively modest protection for ourselves, it does go a long way to preventing the spread of the virus to others if you were to have it and not realize it, which appears to be a relatively common occurrence. So I do think it's important that we wear our masks when we're out and about and when we're dealing closely with one another, because it does decrease the transmission to some degree. You know, if we're out at a crowded venue and in close contact, there's a good chance that several people could be exposed to the virus that day. And I tell my patients that, you know, if 5 people end up contracting the virus at a big crowded event that day instead of 10 or 15, then that has a big impact on the people's lives and a lot of subsequent illness and reducing the amount of severe cases.
So what would you tell patients who are wanting to wear gloves to protect themselves?
When it comes to gloves, I think they can be beneficial in some limited cases. If you wear gloves much like a healthcare provider does, meaning you wear them specifically for one task in one location and then remove the gloves and throw them away when you're done and then wash your hands, they can be beneficial. But unfortunately, wearing gloves for an extended period of time when you're out and about probably just picks up and conveys more germs and viruses to yourself and to others. So I don't recommend gloves for extended use. I think you're probably safer with frequent hand washing and avoiding touching your own face.